Diana, just tell us about what brought you into elder care and how it's been sort of a thing.
Currently run my own geriatric care practice, or care management they call it. We kind of evolved from geriatric to senior care in terms of language. But how I got here was my first job working in activities in a very urban, very busy nursing home in New England, and it was a really rewarding experience, and I benefited from excellent mentorship, which I will always be grateful for. And I stayed embedded very much in the nursing home operations space for 25 years. And then I felt like I had done everything, and then I needed a change. So from there, I evolved into health insurance, and I worked for a dually eligible in the United States Medicare Medicaid plan, running contracting and then later programs, anything related to senior care. So nursing homes, assisted livings, adult day programs, home care, social work, any care management at the time, anything loosely related to senior care and senior care quality, in effort to improve the quality of life for seniors, for their members. So that was great. I prioritized relationships. So it was really hard for me to be in the healthcare space, yet working remote 100% of the time. So I kind of switched again, but this time to consulting. And I did local consulting for the state on senior care programs in the Medicaid space. And from there, did national healthcare consulting, doing quality improvement projects. I loved it. The travel can be a bit of a grind. And so then this last chapter was, I have done all this systems work, and it was great. And I learned a lot, but I still missed the personal interaction, and have come full circle and now work with families and seniors again.
Perfect.
But this time I help them navigate these systems, help them navigate health insurance, insurance coverage, long-term care policies. I help them navigate accessing nursing home level of care, hospital level of care, assisted living level of care, where in the senior care system it is the match between the need of the person, the need of the family, but I have to get it as close as I can for all the parties involved. So that's what I do now. It's super rewarding and can be very frustrating all in the same hour.
But I think, and this is something that I realized in the earlier conversations with you as well. For your breadth of experience, you probably have the most holistic view in terms of the overall ecosystem, right? Like, for example, you work with the facility, and so you work with the folks who are providing the service, and then you work with the folks that are seeking the service. What's the one thing that both sides don't understand about each other, and where's the gap in that? Tell me a little bit about that.
Yeah, to me, and you're exactly right. You described what I currently do and how that aligns with my history perfectly. The number one gap that I see in matching or the consumer's experience in accessing healthcare, it's the language, because the health literacy of healthcare consumers is huge, right? There's very much a range of what people understand is happening, both to them as a person, right? So interpreting medical records or medical interactions. The doctor told me this, or what does that mean for my mother? All the way through to a huge disconnect in language when it comes to health insurance. So I had a situation that I'm navigating in about 2 hours for a family. They were given a letter, your mother is being discharged. The reality is she was no longer going to be covered at a high level of care by her health insurance. It was a notice of non-coverage. We all have these terms for it, or labels, a NOMNIC, but it was a notice of your mom. What it meant is your mom is no longer progressing in therapy. We think this is as good as she's gonna get. You have to decide what's next for her. They read it. They're kicking my mom out of the nursing home at 2 o'clock on Sunday afternoon. So that language disconnect, whether it be insurance-wise, whether it be diagnosis-wise, labels is probably the biggest gap I see. And sure, you can Google it, sure, you can chat GPT it, but until it happens to your mom or dad, and until it makes you assess what do we value as a family, it's super hard to kind of understand at that deep level.
So, Dianna, this is what I love about talking to you. You have this way of pulling out like a true seasoned consultant. You're able to pull out like insights and kind of just bring it down so simply, sort of a thing. It's not that it is done intentionally, but I think some industries they've always thrived on making it sound a little bit more complex than it really is. The way the business works, right? That's something that kind of goes on. I can completely imagine that.
Yeah, and you're right. Like, it's the intent, right? Like, there's no malintent at all.
Of course.
And you don't go into healthcare and do these really hard jobs because you're a terrible, mean person. You go into this hard, let's be frank, there's easier ways to make money than in healthcare, right? Like, if I could just be good at selling cars, I would have been a millionaire, right?
Yeah.
But I could care. I take care of, in my own way, your person. And so there's no malintent, but the disconnect around language and intent is huge. And so I do a lot of education, and I coach the family members through what does all this mean and what are the downstream of kind of decisions that need to be made.
Got it. And Dianna, I mean, this is something that I've probably repeated for the past decade. Somebody who gets into healthcare is really there to help people, right? As you said, there are a million better ways to kind of make monies. So I understand that from a provider perspective or from a facility perspective, overall elder care in the US is obviously struggling with manpower, with getting people to help, sort of a thing. It's a tough job, doesn't pay enough, etc., etc.
Exactly.
Would love for you to share a few thoughts around the overall staffing shortage, and what do you think will get worse over the next few years, sort of a thing?
Yeah, if I had a magic wand, and this was like healthcare for seniors according to Dianna, I would love to solve some of the artificial barriers to accessing care so we could really address people's needs in a kind of holistic, systematic way. So I see one is the 3-day stay that Medicare requires for skilled care. It was suspended during COVID, and for Medicare products, they have eliminated that. But the confusion and consumer education needed around observation care versus being admitted and how that affects many Medicare beneficiaries' insurance. So I get calls sometimes of my mom was in the hospital, but the language they're using is telling me they're not in the hospital. I don't understand. They were there and they were physically there, but they were admitted for just a very short amount of, they weren't even admitted, they were in observation. And trying to explain that to an 87-year-old husband who's slightly hard of hearing, who's so worried about his wife, who's in the hospital, but now he's being told that they're not in the hospital. And then he's like, am I the one who's confused? So I think I would love to have a way to navigate around. And related to that is transportation. We do not have good transportation infrastructure in the United States. For people who lose their license or are no longer safe to drive, one of my most requested services is adult children asking me to help them navigate the taking away the keys for a senior in their life, or helping them come up with a transportation plan. So I oftentimes have to navigate those difficult conversations, and I find it rewarding keeping everybody safe, but coming up with an alternative transportation plan is very difficult. So the labor shortage has such far-reaching consequences for both providers, wanting to run a really good primary care office, wanting to run a really good home care, wanting to be the best nursing home and rehab center ever, wanting to run an assisted living that hits the sweet spot between independence and care. Again, like we said, people wanting to do a good job, but hard to attract and retain employees. One of the things that I do when guiding families and find connecting them with high quality providers that I think are going to be a good match is look at employee turnover and employee recruitment and retention information, direct caregiver questions when considering providers, over look at how pretty the curtains are, look at how the nice carpet in the lobby. And that sometimes is hard for families to kind of orient themselves because they see the pretty building versus the stable healthcare staff. And you can have both, very difficult in this environment. But when I explain to them, I'm going to pick on long-term care, nursing homes, rehabs, and assisted livings for a minute. I explained to them the business model of some of these private pay, out-of-pocket services. There's a cap on what the market will pay, right? So they're pretty price limited. Checking in with the families once the services with the providers have been engaged. And is this a good alignment? A real struggle, and a struggle that's I don't see any good fix, is this home care. People say to me, my mom wants to age at home. And first we do an assessment on, is the physical home conducive to that? Does that mean moving a bedroom downstairs? Does that mean putting a ramp on the front door? Does that mean making your living room a bedroom for a caregiver? Because of housing being affordable housing being a struggle. So people putting in a small house in their backyard for a caregiver and having the adult children live in the main house, but keep an eye on the care recipient. So this issue over direct patient care labor, I do not see any quick fixes. More and more seniors living long, healthy life, which is fantastic, but less and less people to take care of them. And that I particularly worry in the dementia space because so many people with dementia, in my experience, do really well at home for a long time because they can stay in their routine, they're familiar with their environment, they're embedded in the community. And to have to pull them out of that because you can't safely staff their household is very hard for families to understand.
And these are all extremely expensive ordeals, but you're saying it's not so much about the money, but more about how we plan well enough for this. And Dianna, this is one of the themes that actually keeps coming up in conversations that I've had before. A lot of folks haven't planned for this, right? I mean, and this planning should probably happen in latest maybe in your 50s or early 60s. It's always that there. I'm guessing you've had the same experience. Talk me through some of that.
Yeah, you're exactly right. So my typical current customer, for lack of a better term, is an adult child between the ages of 45 and 65, caring for a senior in their life, ages 70 to 100. And if somebody has planned really, really well, they often won't contact someone like me, a navigator, until there's a situation because they have planned well. They just need help navigating an acute episode or a particular thing. And so they engage me, I solve that one problem, I help them navigate that one thing. But the percentage of customers or people that fall into that demographic is so small. 90% of my customers are people who were like, I wish my mom had planned, my grandmother had planned. My senior wants to stay living in this house, but it's not practical. Or they have some money saved, but it's only a year worth of home care savings. And what do I do after that? And so you're right, that proactive planning is why we're here now. And I think one of my strengths is not passing judgment on that when someone reaches out. Like I should have, they could have, they didn't. And it's like, all right, well, like we're here. Let's worry about what is important to you. And let's not have shame and embarrassment around things that you cannot control.
So Dianna, we were talking about this earlier, right? Like if you contrast that to how elder care in India kind of is, it's very different. It's a much it's a much cheaper market. You'll be able to get like an at-home care provider for maybe $400-500 per month, right?
Yeah, I don't mean to jerk, but your point of $400 per month is a perfect example, because I tell families to budget $550 a day for nursing, $300 to $350 a day for an assisted living, and try and navigate some form of home care that would be partially subsidized by health insurance. But that most home cares, I tell family to